Give yourselves a hand. Y'all still here? It's an amazing day. I know learning can be exhausting, but learning can be fun. Learning can be engaging. And we're going to do this one last time. We are here to do what? Take that home with you. So for our closing plenary, we thought it was important to talk about a couple of things where we're going now. Where we're going next. Some of the now, and then how do we walk out of here? So some of you met Kristin this morning, who is with SAMHSA. And I want Kristin to come back up and talk about what's going on, what's new, what's ahead for us. And I know in some of the sessions people may have heard some of the things that are new, but I just want to give us a tidbit of what's going on and what's coming down the pike for us. So Kristin.
Thank you again. Lovely to see everyone again. In this afternoon plenary, I'm going to be giving a bit more information about some upcoming SAMHSA grant programs that we are going to be funding in FY23, which starts on October 1st, and also looking ahead to other grant programs and an enduring commitment to harm reduction with SAMHSA. So, to start with, first, there is the SAMHSA Harm Reduction Grant Program. Clearly, this is a grant program focused on harm reduction. So far, 25 awards have been awarded for this grant program. It's the first of its kind for the federal government in that it is funded not through our normal appropriations, which is boring in terms of appropriations, but it's funded through the American Rescue Plan. And the American Rescue Plan allows for them to purchase the purchase of syringes. So this is the grant program that started in May. You'll see here the important notes. First off, they must adhere to all federal, state, and local guidelines for folks that are funded through this grant program. The Harm Reduction Grant Program, as I said, because it is funded through the American Rescue Plan, it is not bound by the same restrictions of other federal grant programs. I was sitting in a couple of sessions earlier today where people were talking about, funders are very siloed, and I agree, and I share your frustration with that. We are bound by our appropriations, and as a result, we are sometimes a little bit siloed because of what appropriations allow us to fund. This one's special. As I said, there are 25 grants that were awarded. Those grants, I believe they already started work in May of this year. And then the one other thing I will say is because we are still siloed, even though this is funded through a different appropriation, the federal grant program, you cannot purchase, federal funding cannot be used for the purchase of pipes and safe smoking kits. But this one I wanted to highlight. The work has already started, and it's very exciting. As I said, the first of its kind for a federal program. Next, we have 3 Minority AIDS Initiative funding grants, and I want to talk about one of them here. One is a lengthy name, the Substance Abuse Disorder Treatment for Racial and Ethnic Minority Populations at High Risk for HIV or AIDS, or the MAI High Risk Populations Grant Program. This grant program has been offered in the past, and a new version of it was posted earlier this year and will be funded. I believe that awards are being announced at the end of this month, so I can't speak to who was awarded yet. I have not seen the list. But with this, for the very first time, 5% of the grant award can be used for harm reduction programs. This award program also allows for, or rather shifted, previously, SAMHSA grant programs for people who are at risk for HIV did not require a referral to PrEP. This one, with this new version of the new iteration of this grant program, does require a referral to PrEP. The last thing I'll say about this grant program is that it has a geographic focus that previous grant programs did not. That geographic focus, if you are familiar with the way federal grants are awarded, they are awarded on a point system through peer reviewers that do non-biased grading. For those applicants that were in the Ending the HIV Epidemic in the U.S. Initiative's 57 priority jurisdictions, 5 additional points were awarded to those applicants so that we could begin to start funneling federal funding toward those applicants that were in those areas hardest hit by the HIV epidemic. And for those of you who may not be aware of that initiative, Washington, D.C., Baltimore City, Montgomery County, and PG County are all in those jurisdictions. This is where I will give a plug. This one was already posted. However, I learned after I made the slides that SAMHSA's Notice of Funding Opportunity forecast for 2023 was posted at the beginning of this month. I would have a slide for it, but again, I made the slides too late or too early, and I wasn't aware of that then. But you can Google SAMHSA NOFO 2023, and you will see the list of SAMHSA grants that will be posted for applications in 2023. If your agencies are eligible to apply, I urge you to do so. Everybody in this room is doing really great work. And so I would urge you to take a look at those, see what, if any, work that SAMHSA is doing falls within your umbrella, and apply as if you apply, or if you're eligible. So that's those. So now I want to talk about what SAMHSA harm reduction funding can be used to fund. And again, this is new within the past, I think, 6 months or so. So first off, we fund harm reduction services, including overdose reversal education and training services, navigating client services to ensure linkage to HIV and viral hepatitis prevention, testing, and treatment, as well as referral to PrEP, PEP, and other services, referral to hepatitis A and hepatitis B vaccination, provision and education of HIV and viral hepatitis prevention, testing, referral to treatment services, and provision of information for local resources for PrEP. We also, I'm not going to read this whole list, but we also now fund harm reduction supplies. You can see the list of what SAMHSA funds can be used to purchase harm reduction on the slide here. Again, if your organization or an organization is not funded through the American Rescue Plan, unfortunately, this is just the way federal funding is, syringes for the injection of drugs cannot be purchased using federal funding. However, here's a list of the many other things that federal funding can be used to purchase if you're funded through SAMHSA. Lastly, I just want to put a plug. I'm sure everybody's aware of this, but it's a big deal at SAMHSA. 988 is now the National Suicide Prevention Lifeline. This switched over in July. It was a huge lift for the agency, and we're really excited about it, and we're announcing it in a variety of spaces. And that's it. My contact information is on the screen. If you have any questions about SAMHSA programming or SAMHSA, if you want to apply for funding at SAMHSA when we post those new NOFOs, or if you have any other questions, please do reach out to me. I am SAMHSA's HIV policy advisor. Also, I do want to say, as policy advisor, I've been listening to a lot of the conversations we're having here, and I don't know if this is, encouraging or not, but your conversations you all are having mirror the conversations that we're having within SAMHSA, within the HIV team to, continue to focus on, for example, or to try and focus more on food and nutrition, housing, et cetera. Those are the same conversations that we're having at the national level. So I think that it's really great that the local efforts that you all are talking about and the national efforts, we're in alignment in those places. So please do reach out to me if you have any questions. And I look forward to talking with all of you later. If you have any questions, I'm going to stay for a bit of the, I don't think I can stay for the whole thing, but I'll stay for a bit of the networking session as well after this. So please do come, introduce yourself. Email me if you have any questions. And that's it. Thank you.
Thank you, Kristin, and thank you for this morning, and thank you for some great news about new opportunities and how we do this work. We're going to sort of end today talking about how we do this work, and how do we do it, and how do we work with our folks, but how also we do our work in our organizations. We're going to start off with Jona, Tanguay. And they are going to walk us through how we do our work. What does it look like in terms of care? And then we'll end the day with some other tactical skills about how we can do our work. I do want to read the bio. The bio says, pronouns are they, them, practices in primary care at Whitman Walker Health with a focus on providing holistic care to underserved populations, especially sexual and gender diverse people who use substance, and people living with HIV. Jona is a graduate of the Physician's Associate Program at Yale School of Medicine, where they sat on the Dean's Advisory Council for the LGBT Affairs. Their research and educational advocacy focuses on safety, optimism, harm reduction for people who participate in chemsex. They are the founder of chemsexharmreduction.org, an educational organization resource for providers for people who participate in chemsex. Jona is a board member and current Vice President for Education at GLMA, Health Professionals Advancing LGBT Equity, the world's largest and oldest association of LGBT healthcare professionals. Jona has a passion for events planning and as well as a community advisory and engagement. Previously, they shared their experience with AIDS Project and the LGBTPA caucus. Prior to Yale, Jona sat at the executive board of Brigham at Women's Hospital and LGBT employee resource groups. Welcome to the stage to end us out. Thank you.
Thank you for that wonderful introduction. And are my slides? Let's see if we can get those. Oh, perfect. So I'd first like to start off by offering a land acknowledgement. Coming here from DC today, we are currently residing on land stolen from the Piscataway and Anacostan peoples many years ago. So I'd like to hold space for that. If you're ever interested in learning more about the land that you are on in this country, I really recommend this wonderful website called native-land.ca. It's actually run by the Free Nation people in Canada. It's a really great way to learn more about the land that we're on. So today I'd like to talk a little bit about trauma-informed care, which is something that has been mentioned, at least in the afternoon that I got to witness, and also about thinking about evolving that into healing-centered management. There are a lot of wonderful things about trauma-informed care. It's so important, and I think that it's sort of a both-and situation, thinking about how we can be trauma-informed, but also centering healing. So I would like to start off with this wonderful little definition from SAMHSA about trauma-informed care and the 4 R's. Thinking about how trauma-informed care realizes the impact of trauma and that people are living with trauma. It recognizes the signs and symptoms of trauma in our clients and our patients, and looks to find ways to screen for those kinds of trauma. Responds by integrating trauma into both training for employees, but then also organizational policies, and resisting re-traumatization. So what do we know when it comes to trauma and substance use? We know that trauma is extraordinarily prevalent in our communities, deal to so many systemic structures of oppression. We know that trauma, ACE scores, and experiences of discrimination are associated with substance use disorders. We know this through analytical statistics. And what's really interesting that we know from multivariate analyses is that these forms of trauma are additive, not substitutive when it comes to predicting a risk of a substance use disorder. If someone is Black and trans, they are much more likely to develop a substance use disorder than if they were just Black or just trans. Trauma works in synergy. We know that people and organizations who provide care should be sensitive to trauma and understand how it works. And we also know that the patients and communities that we work with are more than just their trauma. They're not just victims. So what is trauma and how does it operate within these systems? This is a really wonderful slide that was made with one of my colleagues who I often present with, looking at sort of how these systemic structural violences create a cycle and that perpetuates trauma and perpetuates inequities in our societies. Thinking about how these isms are at the core of so many of these problems, things like anti-Blackness and racism, homophobia, transphobia, misogyny, ableism, etc., and how these things lead to people having less opportunity, needing to use underground economies to survive, needing to use sex labor, needing to use things like drug dealing, how this then leads to further criminalization, which then causes violence and experiences of violence, which leads to houselessness and poverty, and then the cycle perpetuates on and gone. But at the core are these different isms. That is really the root of substance use disorder. That is really the root of so many of these problems. So thinking about the good and the bad of the idea of trauma-informed care. What's really wonderful about trauma-informed care? A lot of you guys have talked about that. There are so many amazing proponents that are so important for us all to think about. Thinking as a clinician's perspective, thinking about providing sensitive exams when we're going to touch someone's neck, or we're going to do something, or we're going to look at someone's genitals, making sure that we're providing feedback, making sure that they're okay, and making sure that they're consenting, and thinking about, does the trauma they experience actually mean that it would be more harmful to do this exam than it would be to defer and wait because this might re-traumatize them? Recognizing triggers and avoiding re-traumatization that way, and then thinking at the organization level, what training can we provide and how can we make this a safe space for our people? But what are some of the negatives by focusing only on the trauma, only on the idea of harm and the harm reduction? It's about defining people as their trauma. We don't want to do that. People are a lot of things. We want to think about their resilience as well. We want to not just pathologize trauma and confine the narrative that way. We want to, again, focus on that resilience, focus on how people are coping and healing, and think about systems change rather than just the individual trauma, rather than just the story that someone shares. That narrative is so important, but that if we're going to affect change, we need to think about the whole system. What is behind the trauma? What is behind the abuse that someone might have experienced? It's often those isms. Why were they in that situation? It's because of these structural inequities in our society. So I want to, as we talked a lot about today about harm reduction, we've had a lot of great conversations with pushback on both sides about substance use and how, whether harm reduction, like recovery, and what does that mean? What I'd like to talk about today, and what I want you to consider, is substance use for so many people is actually an attempt to heal themselves. There is always another option, and for many people in this society, that option is death. And so substance use can be a way for them to try and self-heal their trauma, whatever that may be. It may be people's escape from gender or sexuality discrimination. It may be an escape from racism and body dysmorphia or fat phobia. It may be a way to deal with their mental health when in our system it is so hard for people to access mental health care that is appropriate, that is understanding, that is trauma-informed, that is trying to empower them to take charge in their own healing. It may be a way for them to escape homelessness and poverty. Engaging in survival sort of drug dealing or survival sex work is a common way that people survive in our society. And then thinking also about the queer context, the specific extra things like queer ageism. And when we're talking about stimulant use disorders and queer communities, which is my specialties, it's a way for people to feel affirmed again in their own community that might be excluding them. So for some people, it's not just harm, it's a way of healing themselves. And we can celebrate with some people when they walk into our door and they want us to meet them where they are and help them the way they want to be helped, not the way that we want to help them. We can celebrate, you're here, and you have been trying to survive. And that is something, because not giving up would be on life entirely. That's the easier thing to do. Surviving is hard. Being here is hard, especially when you've experienced these forms of trauma. So how can we honor that? How can we sort of shift the care models to think more about the resiliency rather than just the trauma and the victim? Celebrate everything as an attempt of healing. Celebrate every tiny positive change. I work with people across a range of goals, and there was a social worker at an earlier session who said something similar, and I loved hearing that it's out in other clinicians in the community. People want to be helped, I already said this, but I'm going to say it again, they want to be helped with things that they want to be helped with. And when they make progress on their own goals, that deserves to be celebrated, deserves to be met with empathy. And you know, one of my other favorite phrases that I've heard is that love is a form of contingency management. When people are disappointed in themselves, when they feel like failures, because so many of our programs, so many of our things set people up for failure and make them feel bad when life happens, you can use love and empathy as a contingency management to say, it's okay, you are not a failure, you are a human being, and there's always another tomorrow. Thinking that wellness, recovery, and health are self-defined. We don't want to define recovery as abstinence, as one person being a productive person. You know, so much of our substance use care, and this is something I haven't heard talk today, is framed in the essence of capitalistic productivity. It's about whether or not someone is getting back to work, whether or not they are using social services, whether or not they are using housing, etc. And that is not what I personally care about, and I don't think that's what us as a community care about. What we care about is that person being a functioning person and being happy and fulfilled in their lives. That is what we should be centering when we think about these things. And focusing, again, not on curing a disease, not on ending the substance use, not on sort of curing an epidemic, but on manifesting health, manifesting wellness for our people, manifesting communities that are strong and that feel like they can handle things themselves, focusing on that healing. Again, thinking about those stigma and biases, removing them, not framing people as victims, but people who are resilient and who have lived through trauma like many of us have, and empowering individuals to create their own narrative. So what does this look like in terms of the future? How can we do this at our organizations in this wonderful city? There are things on every single level, the personal level, the team level, the organization. At the personal level, this is honestly some of the hardest work. It's something that we all work with. All of us have biases. All of us have grown up in this society. We are all internally racist, internally homophobic, internally transphobic, internally you name it. It doesn't matter what our identity is. We are trained to hate ourselves. We are trained to hate others. And it is a lifelong process to unlearn these things. Every day we need to challenge our own biases and expectations and work to try to be better, to be more understanding and more empathetic the next day. We need to receive care. You know, I'm saying this and I'm not good at it either, especially when we're doing this work with people who've experienced a lot of trauma, and a lot of us bring identities to the table where we have experienced a similar trauma. It can be re-traumatizing to ourselves. As much as it's not possible a lot of times because of our healthcare system and access, I honestly believe that every healthcare provider, every care provider generally should have a therapist of their own and be seeking mental health treatment, because we need it too. We are re-traumatizing ourselves, and we need to take care and know our own boundaries. We need to make allies. That's what's wonderful about conferences like these with other trauma-informed and harm reduction providers, and rely on a community that we know is minded the same. What about the team level? A lot of you today might have seen me before speaking at Live Long DC. I do a lot of talking about that. A change in language is essential, and we're going to talk about that a little bit more in the later. Recognizing, supporting our colleagues, thinking about burnout in each other, making space to talk about painful experiences, and validating people for whatever their experience is, rather than providing immediate feedback, and thinking about constructive ways we can inform processes for the future. And then also recognizing that there are different experiences on the team, that some people might have personal connections to forms of trauma that you don't have, and that extra space needs to be made for those people. And then what about the organizational level? How can we make center on healing? How can we create better organizations? Thinking about peer inclusion at every single step, community inclusion. Strong communities are what lower substance use disorder prevalence at the community level. That's what's so important. Thinking about language on forms, thinking about both stigmatizing language like clean and dirty, et cetera, but also about gendered language. Thinking about how easy access is for people to access pharmacotherapies for substance use disorders, et cetera. Thinking about knowledge. So much of my work is about working with people with stimulant use disorders. How many people here can name a single medication for methamphetamine use disorder? There are evidence-based treatments based on randomized controlled trials, which are a high level of evidence, and people are not using these medications because it is not known. So thinking about lobbying our government and our organizations on those issues. Celebrating resilience and empathy, and removing punitive structures everywhere from all organizations, from all programmings. So I'd like to again sort of think about self-care and as this provides to care providers. Everyone here is a care provider. Even if you are not in direct care of a patient, you're working in organizations that provide care. Now, especially for those of us who provide direct care, tolerating abuse does not lead to healing for a person or for ourselves. There is no instance when I think that we should ever tolerate abuse. One of my favorite, when I think about medical records that I received, some of my favorite medical records from long-term, for example, psychiatric hospitals, are ones where I saw a provider who knew their limits and removed themselves from a situation, who is being sexually harassed in the context of trying to treat a psychotic person, but still ended the visit, because at the end of the day, it's important that you be safe. We need to care for these people, but we also need to ensure our own safety. We need to, as I said, care for ourselves. Get a therapist, try and access your resources. I know that's hard. Rely on each other as well. Think about advocating for your own safety, mental health, and support at your organization. Taking mental health days as part of your sick days. I know I say that from a place of privilege. It's hard for a lot of us in a lot of our organizations, but advocating for our organizations to continually do better. And then again, unlearning biases that cause frustration and feelings of failure. I love working with people with substance use disorders. I always have. A lot of it comes from my background, from my personal experience. But when I think about the education I do with other clinical healthcare providers, which is a large part of my role, I see a lot of burnout. I see a lot of frustration, and I see a lot of the phrase, I want to work with people that want to help themselves. If you are working from that aspect, every day of your life will be a failure. You need to work with people and the things they want to be helped with, and you have to recognize that burnout is a choice when you are seeing the success of yourself as whether someone else complies with your will. That is not our job as care providers. Our job as care providers is to provide the care that people want in the ways that they want it, in a way that is affirming. And then you'll never be burned out. Yes, frustrated certainly, and there are ups and downs. I'm not proselytizing, but absolutely. The key to burnout is not setting your own self up for failure or the patient up for failure. So thinking about language. I touched on this earlier. I say it all the time. Language doesn't just go for pronouns. It doesn't just go for gendered things and things like that. It's also about the way we talk about substance use and substance use disorders. Moving away from MAT, we would not call insulin an assisted treatment for diabetes. We would call it treatment because it's treatment. It's the same thing with medications for opioid use disorder. We would not, the number one word, if I would say if there's anything to take away from this little segment on language, to remove from our language, is the word abuse. There is great evidence out there that using the word abuse has a real effect on people's lives and on care. It leads to clinicians believing that punitive actions for patients are correct. It leads to clinicians believing that patients don't deserve treatment and denying them treatment. It leads to all kinds of negative health outcomes. So removing that from our language as much as possible and realizing not everyone who uses an opioid, who uses meth, has a substance use disorder. Having a substance use disorder means specific criteria from the DSM-5 you can think of as like chaotic use. Very specific criteria, and that actually the majority of people who use substances, even hard substances, don't meet criteria for a substance use disorder, and that they may at some points in their life and not others, and that we should support them where they are and support them on where they want to be in that spectrum. Thinking about moving away from words like dirty or clean, thinking about moving away from relapse. Again, words that cause people to feel like failures and for us to feel like we have failed when someone is not doing what we think that they are supposed to be doing. So I'd like to wrap up on that in terms of the future. What can we do when we go forward? A lot of us are tired. We will continue to be tired. There's a lot of work to be done, but there's also been a lot of ground that we've covered. As we go forward, trying to center healing, thinking about the trauma, thinking about our lived experiences, but thinking about how we can manifest a community that's better, that's more loving, and is a stronger community. Thank you.
Thank you very much for that. It's important how we work, the language, the words we say. They are very powerful. What's also important is the workspace itself. Is it a healthy work environment? Is it a place that supports the kind of things we're hearing today? So we're going to end on talking about that space and how we can create the space that affirms what we just heard. So, Ebony, it's you.
All right. Hello, everybody. Ooh. Glasses and mask are not a good combination. All right. So good afternoon. Good afternoon. We had a long day, didn't we? Did you guys learn? Did it feel good to be out of the office? Right? And so I want us to think about throughout this presentation, what is our workspace like? Are we working in environments that are facilitating health, or are we seeing something else? Because again, we're talking about healing for the healers. So let's just take a look and let's take a listen. Maybe. Right? Does this look familiar to anybody? Do you ever feel like you go into the office or you get up into your virtual space and it is non-stop? There are so many demands. And sometimes that culmination, that clock, the time, the clients, the perpetual running on fumes. Does anybody here find themselves saying that they're running on the fumes? Sometimes it is a hallmark of a toxic work environment. Toxic work environments can create issues for both the employers and for the employees. Hostile work environments can hinder your effectiveness, undermine your job satisfaction, spoil engagement with work, and cut productivity. And so when you're thinking about this, you want to ask yourself, but what does that actually look like? Because sometimes we may say, well, am I just tired? Is it just my perception or my perspective? Well, let's take a look and see what the signs look like. Lack of control. Have you ever been in a work environment where you are unable to predict even the most basic things, unable to negotiate and navigate a stable work schedule? Heavy workloads where you're overwhelmed until the next task comes and then you're flat out exhausted. I've got a lot of great ideas, guys. I know some things that can improve it. I'm talking to the clients, I'm meeting with the funders, but guess what? Nobody's listening. Right? Man. You know, I came to this harm reduction conference today. They had the Narcan, they had the specialists, the outreach workers. My job just won't invest in anything. Do we know what that's like? Right? Working in their unclear job expectations. So when I was hired, and I remember the interview because I had on a blue dress, but now what I saw in that paper and what I'm being asked to do, they don't even align. I don't know how much work is reasonable. Is the environment that I should be constantly overloaded? There's no work plan, so it feels like we're flying by the seat of our pants. There's no guidance. Corey, you're so good. Just keep on doing what you're doing. You can figure it out. Ask the Google, right? And then who do you report to? One minute you're getting directions and guidance from one person, then somebody else, and then that's where the conflict sets in. Is any of this resonating? Right? And this scarcity of support. Right now, we're talking about people who are quietly quitting. Does it mean they're resigning? No. They're still at their jobs, they're just less present. Right? Because when that support is called for and that answer is not met, many people at work just kind of fade into obscurity. They sit back in their cubicle, or let alone behind their Zoom, and they're isolated without mental health support, lack of positive team dynamics, supervisors that don't engage because everybody is running on fumes, right? Limited social interactions after work because I got to do this, and I was going to go jogging, but I need to get this report in. And earlier, I think you all heard somebody talk about employee assistance programs. Did someone see that presentation? Right, but not every place even offers that. So what happens is not only are people starting to feel overwhelmed, they're also starting to feel alone. Right? And so then what we find out is, so now, again, we talked about how these jobs define so much of our identity, how they're so linked to our purpose, our repaying our debt, our showing up and proving ourselves viable, helpful, of service. But then that service gets oftentimes so over-encompassing that we don't have a healthy work-life balance, right? Bringing work home occasionally here and there becomes business as usual. Work dominates all of your time and all of your plans. Sometimes you go and you check your leave balance and you look like, wow, I've got a lot of sick days, but I don't have time to take off to go to the doctor. Right? For those of you all who were in the afternoon session, policies are only as good as practices. Having leave and using leave is not always the same thing. Work begins to consume your thoughts, right? So you're in the shower, having a whole KMA moment, and then somehow you're thinking about clients and reports and timelines. Should we care? Absolutely. But we also need to be able to punctuate those experiences and create time for self-care, for restoration, for balance, so that we don't feel like, particularly in the virtual environment, that we're working at home, opposed to many of us feel like we're starting to live at work. Right? And so what that means that we don't do is have time to enjoy our family, our friends, our hobbies, the things that we love. And the more we resent, the more we are taken away from the things that we need to do we start to become resentful. Right? What about the dysfunctional workplace? Working where there's bullying, sexual harassment, people are being undermined by colleagues, supervisors, micromanagement, conflict goes unresolved, and to make it worse, there's limited accountability. The buck never stops with anyone. These are all hallmarks of a toxic work environment. Policies and practices don't align. They're not the support for the issues that we believe in. Human rights, Black Lives Matter, president's agency, access and power for people across the LGBTQI spectrum, even harm reduction, right? We know that we work in this field with some people who do believe that people who use drugs should have access, but for them, access looks like abstinence. And so these are all the things that can get misaligned and stop us from giving our best, doing our best, and truly actualizing our purpose. Right? Working at home, 69% of people nationwide are burnt out. So people are working in their environment that's most comfortable, but they're working when they brush their teeth and they're working when they go to bed. Can anybody relate to any of this? Anybody experience any of this? Right? And so employees are responding to emails, to group chats on Zoom, and it feels almost 24/7, because if it's not that, you're managing your work social media. And then let alone discrimination in the workplace. Right? Discrimination is not just somebody called you and explicative. Discrimination is how you're spoken to, how you're handled. Are there accommodations? Is there judgment? And so we know this for people who use drugs, ethnic and racial minorities, people who face discrimination based on their sexual orientation, gender identity, disability, and religion. And this is hardest for people who are working in helping and healing fields, fields where you should feel safe, fields where there should be strength-based and rights orientation, and you find yourself on the inside still having to fight as if you were on the outside. Right? And so when we're talking about this toxic work environment, it often leads to burnout. WHO says burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So it's not just the stress, it's the fact that it's stress without management, without resources, and without support. Right? So what happens when this burnout shows up? What happens when the burnout shows up? Excessive stress, fatigue, insomnia, sadness, anger, or irritability. Alcohol or substance misuse, heart disease, high blood pressure, type 2 diabetes, and vulnerability to illness because your immune system gets weak from that stress, right? So we have to have healing for the healers, but how do we do it? What does it look like to halt, reverse, and change the trajectory of the workplace? What does it mean to create safe and healthy environments for people to work? So all of you out there who are employers, paying fair and competitive wages, hiring ample staff members so that people aren't trying to do 2, 3, 4, and 5 jobs. Cross-training. Cross-training can mean that someone can take a vacation and not come back and have 50 emails in their box because they no longer have to be indispensable, because there can be a shared vision and shared workload. Eliminating the culture of volunteerism and unpaid work. Oh, you know what? You are so dependable. You know, you did such a great job last time. You know, she's going to be out. We just need you to step up a little bit. I mean, you don't mind, surely, right? Because you care about the people. And so at some point, caring, not only can it become exhausting, it can become exploitive, right? And people need clear and accurate job descriptions. I can do what I do if I understand what my instructions are, right? Creating inclusive and supportive workplaces. Everyone should have leave. Ensuring workplace protections against discrimination, racism, and other forms of rights violations, including, and particularly today, violations against people who use drugs. Ensuring there's employee assistance programs, that it's not an anomaly, but it's standard practice. Making accommodations for people who are differently able. Investing in workplace mental health and support programs and services, and being so intentional about the new normal. Before COVID pandemic, a lot of these things we weren't discussing, a lot of these conversations we weren't having. But as we come back into these rooms, as we come back to the workforce, we have a new opportunity to shape the world of work and the way that we want to work together. Right? So managers, are there any managers in the room? All right, well, this is for you. Right? You want to model balance. And when I say model, your people are looking to you for guidance. And they're not just looking at what you say and what you send in an email, but what you do, what you're practicing, what you're building as the core of your team culture. Again, cross-training, assigning reasonable workloads, setting feasible timelines for completion. There are times we want to say things are urgent, but urgent shouldn't become business as usual. Ensuring consistent applications of policies across teams. So if you need a leave slip, you need a leave slip as well. Because what that does is when you show that disparity, it undermines teamwork, team process, and team trust, right? You want to provide and delegate coverage when team members are out. If you're on vacation from Whitman Walker, I want to know that you're getting a tan. I don't want to think that you have to worry that things aren't managed while you're gone. Anybody ever come back tired from their vacation because they were sunbathing and working and emailing and reporting? Do you guys know what that's like? So managers, we need you to help people as they move into the new normal of self-care, right? Make mental health and well-being a priority. We don't want to wait until you get an EEOC complaint. We don't want to wait till someone has said, I need 6 weeks out because I'm burnt out. We want to manage a culture where mental health and wellness in the workplace is a part of a normal, healthy work culture. Allow people to use their leave. Create a safe and supportive space in supervision, right? Be motivational, be empathetic, be respectful with your team members. People spend a lot of hours at work, and it needs to work for them as they work for you. Use strength-based approaches and affirm team members' values. The days of the iron fist are over. And survey says it doesn't work, right? Again, we want to model. We want to model listening, not being defensive, because those are the same skills that you're modeling that your employees are going to take out into the community, to partners, to clients, and also that they're going to be able to reflect back in working with you and working with the team. So what can you do for yourself? We started out this morning talking about what you can do for yourself, how you can promote your own healing as a healer, right? So one, you want to develop positive patterns. Delegate tasks, take breaks, use sick leave when you're unwell, regenerate, restore, recuperate, and come back at 100%. Come back ready to work. When you're at work, do your 9 to 5. Don't be on the phone catching up on the latest P-Valley. You want to make sure that you're focused. And when you do that, when you get off, you can leave with a clear feeling of satisfaction. I spent my day, I was productive, I was constructive, but now I can move to the next phase, right? Limit taking work home, ask for help when needed, and if you're unclear about your work, about your scope, about your role, speak to someone, get that clarity, because you want to, if you're in your purpose, you want to understand and make sure that what you're doing is well aligned, right? Set healthy boundaries. Power down. It's okay to not always be available. And I think when you're working in a helping field, sometimes that's a hard concept because it feels like That's your superpower. Many times I go into a room and I ask people, what is your greatest asset? What do you bring to public health? I do anything, all the time, for anyone, under any I would walk out in a blizzard for my clients. But maybe you aren't the person always to walk out into a blizzard. Maybe it's the people who have a 4x4 and a blizzard-proof vehicle because that's their specialty. And it's okay for us to start punctuating and setting those boundaries. Because when we do come out, when it is our season, we can show up, show out, and actually do our best. Right? Think about, can I take on more? And does your role honestly fit with your professional vision? If you're coming to the work and you're dissatisfied, your clients will be dissatisfied, your colleagues will be dissatisfied, and your work may not be at the quality that you are actually capable of radiating. So we have to also be introspective and say, where do I fit into this? And does this make sense for who I am, what I need, and what I want to do with my professional life? Right? Practice self-care. Practice self-care. For so many times we said, I don't want to get therapy. I don't want someone in my business. I don't want someone shrinking my head. But now we understand those are the resources that bring the release. Those are the resources that bring the release. Give yourself permission to rest. Eat well. Reduce things that you know will keep you in a cycle that you don't want to be in. Exercise. Spend time with your family. Do things that you love. And reduce heavy consumption of work-related social media news. I can't leave work. Well, that's because you on Planned Parenthood's Twitter, you on APRA's homepage, you on HOSTA, you on HRSA. And so sometimes we have to step up and step back. Can we say that together? Sometimes, oh my goodness. Can more of us say it together? Sometimes we have to step up and step back. Right? And so give yourself permission to be where you are. Don't be defined by others. Don't be defined by your job, role, or title. Show up, start and restart as many times as you need. Don't stay stuck. Right? If that environment is not for you, ask what is and be courageous to make the shift. And remember, please, as care providers, the care is not just for your clients, the care is also for ourselves. That same empathy, compassion, patience, motivation, we have to be focused on turning it inward. Be gentle with yourself as you become your best self, and the more you invest in you, the more that you have to give. Thank you, guys. As we've been here today, I thank you. I want to thank the panel. Can we give the panelists a round of applause? It's been a long day, and I hope everybody has gotten a clarion call today. I hope that you're feeling restored and renewed. I hope that this has been a moment of burst of clarity and reminders, reinforcement, reinvigorating, so that you can be in that purpose to do that sacred work. I invite you guys to think. How do I care for my clients while caring for myself? How do I want the best for my clients while checking my own sense of ego? How do I encourage my clients to be their very best? Emphasis on their best, not my vision. It is an honor to be here with you. I hope that each of you continue to do this work, continue to partner with community, continue to advocate not only for policy changes, but also for investments. Investments into resources and organizations, but also investments with each and every person you work with, reaching the core of their humanity. And please remember, when you need to, step up and step back. Thank you.
Can we give a round of applause to our panelists? They told us what's new, they told us what to do, and they told us where to do it. So we've got some work to do. I'm gonna say thank you to you all. I know it's been a long day. Y'all can probably tell by my voice it's been a long day, but I can say it one last time. What do we do? I'm gonna let y'all have that one because it's a long day. I'll let you have that one. I am also going to do something. None of us do this work by ourselves. Stacy from the health department is still here. I want to thank the health department for their work, for their support, for their vision. Some of the team members from the Health HIV is here. Brian is in the back. I want him to stand up real quick. He doesn't like this sort of stuff. Brian is our fearless leader. Cersei is our director of communications. Stand up. Yes, stand up. And then you met Corey. There's some other folks around here dipping in the background. But you know who sings the best? Our background singers. So can we give it up for our background singers at the health department? I want to thank you for your time today and your attention. I want to thank you who do the work. And I want to thank you who come to receive the work, because we're both in the same place. So I want to thank all of you. Lastly, I want to make sure that as you leave today, do a couple of things for me. Do me a favor. Take some pictures out there. Tell folks where you were. When we get outside for the reception, which is going to be down to your left, you'll see banners there. Take pictures. Tell people what happened today. Tell them about what you learned. Tell them how you got a little unnerved by what somebody said. Tell them how I'm going to think about that. But take a picture and take that back with you. Our next journey is going to be our next reception. And it's going to be a networking reception where you'll get to talk to folks, and we're going to have different tables with different ideas on it. And we want you to think and talk with each other around those ideas. The day is not over. This might be that re-energizing. There'll be some food and just some beverages down there. So I want to be clear. And I want you to just network with each other. So I just want to say again, on behalf of Health HIV and the DC Health Department, thank you for an amazing day, the inaugural, but not the last, Harm Reduction Conference, DC Engage. Please post on your social media pages as well, too.